Hey guys, what's up? So, yeah, big news coming out of Japan right now. 41 new cases of coronavirus on the cruise ship. Um, and that's just on the Diamond Princess, the same one. Um, so now that brings the total up to 61 confirmed on that one cruise ship, the Diamond Princess. Let's bring that up. Not the greatest, for sure. This thing, obviously, is wow, is very, very transmissible. That's the word I'm looking for. It's vicious. I'll say that. Um, yeah. So, 41 new cases on quarantine cruise ship off Japan brings total to 61. Now, I'm kind of concerned. Let's see what's going on here. 41 cases of coronavirus have been found aboard the cruise ship Diamond Princess. 41 are in addition to 20 previous cases detected in preceding days. Counts. Princess Cruise did not immediately reply for request confirmation. People are saying, yeah, like they're saying that there's people coughing in the hallways and they can hear people coughing, and it's they're all probably in rough shape right now. Even the people who aren't suspected are probably, yeah, they're not in a good spot. They should have tried to do preliminary tests and got the safe ones off first. I would have think that's what, but anyways, let's continue reading. Dodo News also reported 21 of the 41 new cases of the people of Japanese nationality. Okay, so also citing the Ministry of Health, Labor and Welfare and Japanese TV, 61 of those positive tests for coronavirus came from the 273. Wow. So yeah, they didn't do any more tests. Like, these are from, still the initial 273. They're going to test these ones first, of course. You would see, and then I'm sure they're testing, others. I'm sure that's not good numbers. 61 positive. Yeah, so word of those results came in as the ship entered a 4th day in quarantine. Yeah, so it takes a little while to do these tests, right? So Princess Cruise officials did tweet earlier that passengers inside and non-lobby balcony staterooms are now permitted to get fresh air on a rotating basis. Yeah, you couldn't just leave people in those rooms. Oh my god, that's like locking somebody in a closet. Really, it is. Like, they're not very big, and there's no air circulation barely. And if it is circulating, you're just circulating other people's, infectious disease through the ventilation system. I would imagine. I don't. Well, you would think. If I don't know. As directed by public health authorities, a notable improvement, especially for those previously confined to the window rooms. The ship carrying 2,666 passengers and a crew of 1,045 crew members is expected to remain where it is for 2 weeks. The ship's passengers began their journey on the January 20th, and the cruise was to have ended February 4th. Yeah, so they're stuck on there. They're quarantined for 2 weeks, at least. They're bringing the most sick into the hospitals, so now they'll be, that's going to jam the hospitals right there, because these people aren't really from that area, so they don't really have a place to go unless they're going to be going to like a quarantine camp, or that's probably not the greatest place to be.
Milk.
Yeah. So, Japan's news reported that the test results for about 170 Diamond Princess passengers and crew remains pending. The passengers have been asked to stay 2 meters apart while eating. Geez, I don't think that's really gonna matter. It's probably on the utensils. It's probably, like, you know what I mean. That's my I don't know. I could be wrong, but we don't know what this is, and it's obviously spreading viciously. I'm not sure. You know, it's hard to tell, right? But you know, it's obviously infected quite a bit of people on that ship, because 273 passengers, and yeah, so I think it was, what was it, 70? So yeah, I can't remember what the original number. Yeah, that's not good. So 273. So far 60 are, you know, and there's another 40 that came back positive. Like, you know what I mean? Like, you're getting that news, they're just going to be taking you off the ship, right? And you can only imagine, like, there's just going to be more. If they're on that ship, I could just imagine that, yeah, it's only going to be, if they don't have it now, they're gonna probably catch it. That's not cool. I don't know how they're handling this. I don't know how you would handle this, but it just doesn't seem like it's being handled the right way. Yeah, 41 new cases of coronavirus have been found aboard the Diamond Princess. There's still another cruise ship that has been quarantined as well up there. There's 2 of them now at this moment, and waiting on results from the other one as well. There's 3,700 people on this ship almost, and people were saying that the crew was sick. The crew was sick and people were coughing. Let's go back. Yeah, this is, yeah, so that brings the total of infected to 61. Yeah, I keep hearing painful coughs. And this was 14 hours ago, so oh yeah. Anyways, that's when they detected the first 20. Yeah, these guys have been giving me a hard time. Sometimes I can get through, sometimes I can't. I'm behind a VPN, but they still get me. Yeah, it's a hell of a situation developing, and it's not really being reported on a whole lot, as I don't know, as much as probably it should be. Yeah, so there was an evacuee from Wuhan, China, who arrived at the Marine Corps base
14 days in, and we were headed out. Checking out.
Yeah, sorry about that. Yeah, an evacuee from Wuhan, China, arrived at the Marine Corps Air Station in Mirar in Southern California. He was transported to local hospital after developing a fever or a cough. It must be a cough, I guess. I don't know. The Centers for Disease Control and Prevention, CDC, said in a statement Thursday. So he's, you know, they landed. He was on one of the airplanes that just arrived in the U.S. And you know, he's sick, and probably all those people were now, you know, if they were healthy, they might be sick now. We don't know how transmissive this is. And they've, you know, the World Health Organization came out and actually said that they have very limited data on it still, and they're trying to get the world's best on it. And they said it's going to be next week. When I heard them say next week, I thought, like, what? I thought they'd be already on top of this, like. But they do have a unit, I guess, a tactical team that has gone to China, and they're doing data collection as we speak. Who knows where, but the World Health Organization did send them in there. They invoked the Global Response Preparedness Program. So that involves global security and global surveillance. All kinds of just, there's no borders now. They can surveillance whatever they want, wherever they want, with whatever technology they seem fit. And the Chinese government has sent out through their Daily Mail. I was like, wow, they actually said that they were using drones and robots to safeguard the city. So yeah, it's all interesting, right? This because the cities are locked down up to there. It's it's big. It's big. And then the doctor here, Dr. Lee, they said that he died and that he didn't die, and then but yeah, he actually did.
A Chinese doctor who sounded the alarm on the Wuhan coronavirus died of the virus in the early hours of Friday morning, according to a statement from Wuhan Central Hospital. Li Wenlian was rather accused of rumor mongering by Wuhan police after raising concerns about the virus in December.
He was among several whistleblowers that emerged in that moment. Even the Supreme Court of China said that had local authorities listened early on, and Wuhan police in particular, things might have been different when it comes to the current outbreak that China is experiencing, and really the global community is experiencing right now. The second narrative that's coming out of here now is this concern with state media and how they first reported this. It was late Thursday night, just a few hours ago. They suggested that he, in fact, did die. And then the outrage and the emotion and the anger on social media here was quick, and it was sudden. I mean, it came through and it erupted. It was trending, and folks were really starting to express themselves like you had not seen here in years, to be quite honest. Then what happened was state media pulled it down, and they did that inciting Wuhan Central Hospital. And Wuhan Central Hospital said, he's not dead, he's in critical condition, and we're trying to resuscitate him. And they maintained that statement for several hours. Meantime, the tweets that came from Global Times, the tweets that came from People's Daily, which is the ruling Communist Party's official newspaper, those were deleted. And folks online continued to express their concern. And what we're now seeing is they're posting back again. But one top comment that's getting a lot of likes right now is somebody saying, you can repost this in the middle of the night thinking we're not watching, but we are up and we are watching. Zane?
Yeah, a lot of questions about transparency here. David Culver, live for us there. Thank you so much.
Yeah, it's
A manhunt is underway in Jerusalem
crazy.
after a car ran down a group of Israeli soldiers. A manhunt is underway in Jerusalem after a car ran down a group of Israeli soldiers in the early morning hours.
Why can't I mute that?
Defense forces say a
Okay. Wow. I thought I could mute it on the tab, but I guess not. But yeah, when they covered it up, China caught it. It's not the greatest outlook of situations here. It's starting to get out that this is, it's getting a little crazy. You got 2 BC visitors test positive for the Wuhan coronavirus. So now BC has 4 cases now. They also got a couple of people that are suspected. Toronto's got some more suspected. Yeah, it's just, they don't know anything about it, right? They have no idea what it is, and then they're coming out and giving information about past outbreaks. But past outbreaks didn't shut down the whole country of China. They didn't shut down one city, let alone a whole fucking country. Excuse my language, but no, it didn't happen like that. And it's, you can see the outbreaks starting to spread. They're actually spreading in local chain groups, which means that somebody who hasn't even been to Wuhan, or just some random person at the mall catches it. Like they just from somebody who was there or who infected somebody else or whatever, right? And that's happening, it's spreading. So it's not the greatest. This here is the first case report from coronavirus in the United States, and it's courtesy of the New England Journal of Medicine, and this is a published report. So it's as scientific and as good as we can get. Not to say that they wouldn't update something if something changed, but this is published and it was posted up here on the journal. So and they're saying a lot of cases are different, even though it's showing a wide variety of symptoms. Some people are showing gastrointestinal illness, and some people are showing diarrhea. Some people are showing cough or dry cough. Some people aren't showing any signs at all. So yeah, it's so this is the first case, and it was a 35-year-old man presented to an urgent care clinic in Washington County with 4-day history of cough and subjective fever. On checking into the clinic, the patient put on a mask in the waiting room. But did he actually? We don't know that. Maybe. So after waiting approximately 20 minutes, he was taken into examination room and underwent evaluation by a provider. Disclosed that he had returned to Washington State on January 15th after traveling to visit family in China, in Wuhan, China. So, you know what I mean? Like this guy who, like, he's 35 years old. He's not an old person. Like some people are stating, like, it's only affecting old people and blah blah. And it's affecting everybody equally, I think. The patient stated that he had seen a health alert from the U.S. Center for Disease Control about the novel coronavirus in China, and because of his symptoms and recent travel, decided to see the healthcare professional. And he developed a problem. And then he started to show signs of pneumonia after a little while, after like the 4th day, and then he started to get better. He started to get better, and but he still was testing, still testing positive. So reported showing no evidence of anomalies. However, a second chest radiograph from the night before, day 5, showed, illness day 9 showed evidence of pneumonia in the lower lobe. The patient's oxygen also dropped to 90% while breathing ambient air. On the 6th day, the patient was in the hospital. The patient was started on supplemental oxygen delivered by nasal, 2 liters per minute. Blah 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 blah. But you know what I mean. They had a rough time. Like, there's all different types of situations. Like, everybody's kind of reporting different cases, but all like different symptoms, I guess. Like, some people are showing nothing, some people are, really bad, some people are, just kind of like flu-like symptoms, and maybe are like they just different stages. Do you know what I mean? Like, who knows, right? But there's still so much unknown, and that's the worst of it. It's unknown information. We're going to check this out here really quick, and this is just some images to show how packed the hospitals are, and these are older, by the way. I found these, or I've seen these, probably 2 weeks ago at least, some of them.
China is on a war footing. Unverified video on social media shows streets in Wuhan, where the virus originated, being sprayed with disinfectant.
Is it
but
disinfectant?
Questions linger over how China's government is dealing with this invisible enemy. Few countries can marshal the resources now at China's disposal. And that's the thrust of the narrative on state-controlled television. But hospitals are swamped with an acute shortage of beds. Gymnasiums and sports stadiums have been turned into temporary medical centres to cope with demand. On Thursday, the death toll reached 565. The latest infections included a newborn baby. But China's government says the number of virus victims who are recovering is also increasing. Here in Hong Kong, the fear of catching this virus appears to be more contagious than the virus itself. On Thursday morning, there were reports of panic buying in some local supermarkets, with shelves being cleared of rice and other staples, forcing the Hong Kong government to say there's no need to worry, there's plenty of food. But there are not plenty of face masks. Those that are on sale cost 3 times what they did before the crisis began. People we spoke to don't understand why the government isn't providing them for free.
There are many poor people, they have to queue up to buy the mask, and I think the government should do more on that to solve the problem.
They are not doing enough because they did not plan ahead to purchase the mask for the citizens. Yeah, so now the prices for the mask is like going up.
The day after the Hong Kong government announced it would soon begin isolating all arrivals from the mainland, it remains unclear how that will happen. The two options appear to be self-isolation or being placed in holiday camps converted to quarantine centres. In Hong Kong, a luxury cruise liner, the second in Asia with infected passengers, is now a floating quarantine centre as medical teams continue screening the 3,600 passengers and crew. The authorities are also appealing to passengers who were on a previous voyage to get in touch, fearing thousands more may have been exposed to the virus. Adrian Brown.
Yeah, that's kind of freaky, eh? You know, there's like all those people out there now, like, continue, who were on this voyage before, and not just this voyage, airplane flights, train rides. You know, this thing's obviously dangerously infectious. We got 42 new cases of coronavirus on the cruise ship. So we're up to 62 out of 271 tests taken. Those are not good odds, and of the first 31 tests that came back, 10 were positive, so that's like a third pretty well, out of random testing. So, you know, it can fluctuate a lot either way for sure, but 61 positive out of the first, even 10 positive out of 1,000 would be too many, but these numbers are actually quite remarkable, really. Yeah, it's just exploding in the Asian Peninsula for sure, and now it's starting to take off. You know,
Jeremy is a global expert on infectious disease, and he's also director of the Wellcome Trust, which is one of the world's.
Yeah, but yeah, city lockdowns in China. They locked down 53 cities, excluding municipalities in Hubei province, so where the place all began. 53 cities had imposed restrictions on movements of the public as of late afternoon, February 5th, according to the tally. And this here's like a pass that allows people to go out. Like, if you don't have a pass and the police find you, then you're arrested, I guess, or I don't know. Like, that's crazy. We'll start lockdown restrictions from tomorrow. A woman in her 30s said she was surprised by the details of the restriction. Yeah, I guess she would be. Authorities are tightening restrictions day by day. We don't know when the restrictions will be lifted, so our concerns keep growing. Yeah, and rightfully so they would, and I think everyone else's around the world are growing by the minute. Yeah, there's a Yeah, they're canceling all public gatherings, schools, anything of, you know, they're trying to keep people away from each other, but it's not working. It's still spreading. You know, the numbers keep going up. We got 39.8. It's jumping. Look at that spike. That's unreal. And I know it might not look like very much, but that's crazy bad. But the numbers, you know, the numbers aren't right, even what they are reporting. Because it takes time to do these tests. The healthcare is absolutely strapped there. You know, they're just flooded with people. I don't know, I guess that's the same tab. Yeah, gastrointestinal symptoms may be overlooked. Coronavirus cases. Yeah, that's it there. Again, the patient 35% with these gastrointestinal symptoms. Dry cough, but no shortness of breath or chest pain. On the second day of hospitalization, the patient passed a loose bowel movement and then reported abdominal discomfort. Similarly, yeah, and but GI symptoms can be clinical feature of coronavirus, but it's hard to recognize it. Yeah, this is totally different, right? They're kind of saying, however, in terms of novel coronavirus, which means this one, the new coronavirus, it is important not to assume that all patients are having these symptoms, as illnesses never have uniform symptoms, and there can be quite a spectrum of disease, right? But they are seeing quite a spectrum. They're having mild cases and severe cases, and people who aren't showing any symptoms at all, but still, you know, still being infectious, which is quite concerning as well, right? And BC, and they're monitoring more people. They're waiting for more tests in BCs as well. Health Minister said 4 cases is a significant number, but everyone is self-isolating. I don't think that's gonna help. Well, unless you self-isolate everybody, because you don't know who these 4 people who might have even spread it to 1 person, who just spread it to 3, who just spread it to, and those 3 spread it, you know, it just, we can't see this, it's invisible. You know, like they said in the World Health, it's like, you know, we're shadow boxing right now. We can't see what we're swinging at. But obviously it's bad. So 27 cases of new coronavirus spreading human to human outside of China. That's, you know, that's alarming. Outside of China, 27 cases. Yeah, she's second presumptive case has been identified in British Columbia. Yeah, that's kind of old, but yeah, Tuesday confirmed 27 cases of coronavirus spreading person to person outside China. And we don't know, we can't really know the numbers of this. We don't know nothing about it. Looking for 65 or 675 million, because they're kind of broke, World Health. And 2 Canadians on the cruise ship are positive for it. I think there's 200 and some Canadians on there, I don't know. And just a bunch of people, right? It's all people now. Hong Kong potential catastrophe. I think, like, it's all China. Like, they're just like, oh well, you know, Hong Kong. It's not like it's Wuhan. Like, well, you know. And I don't know how long people can last. Quarantine passengers aboard the cruise ship. Yeah, like these people are all confined to their cabins too, right? But they did start letting people to get it out to get fresh air. So like, why even confine them if you're just gonna let them get out? You know, like they don't know anything about how it's being transmitted. Yeah, crazy, right? Third case in the UK. Oh, sorry. Yeah, third UK case caught in Singapore. Yeah, it's big businesses are shutting down there too. Big businesses. These people weren't too happy about being cooped up in their cabin. Yeah, it's just non-stop. Yeah, 251 Canadians. Now there's two cruise ships involved in this quarantine now. They haven't got any tests back from the second cruise ship. Like, you know, like they're taking, it's unreal. Like they're literally like arresting people for not wearing masks. And I kind of thought this, you know, these were kind of a little far-fetched at first, but then once I started seeing all these stories pop up, you know, confirming that the police are actually like arresting people for that. Apple pulls out. Apple ceases all business in China. That's huge. Yeah, that was funny. Chinese health officials offer guidelines as China prepares back to work. They told people to stay away from each other on public transport systems and drive with the windows down. But people weren't really going back to work. No. The people are very upset at China right now, or their upper government. No, see, that's like a fake. Like you can tell that's a fake person there. Yeah. And see, there's the military order there from Chinese.
And they can throw.
Orders the military to go into Wuhan. Like, you know what I mean? Like the military is nuts there. They really are. It's a communist run country, and they're like really like they're just destroying people. Like they're treating them like animals. It's an absolute disaster. You know, it really is. Like people are just getting treated like shit.
最更加让我震撼的事情，这个我这位台湾的朋友去江泽民家去看江泽民的时候，他进去以后，江泽民呢，老人家用英文不用中文，用英文跟台湾朋友讲：世界要乱啦，中国要出事儿，你们要准备点后路啦。
Like these guys building the hospital all started rioting. Wow, they're boarding people inside.
现在就像我在几周以前说的，整个中国的这场疫情，接下来将形成人与人之间最大的一场仇恨的战争，就是共产党培养了70年人与人之间的自私、拉仇恨，和对人的洗脑养成的无知无畏，那种暴力行为。和整个全民都是有心霾的这种情况，将导致人道大灾难，这是很恐怖的。这场人道大灾难，正在迸发中，在全国各地。请告诉我，发动的是共产党，谁能停下来？一旦启动，没有人能停下来，就像这个冠状病毒一样，被共产党被共产党的解放军给放出来，或者是无意放出来，他能收回去吗？他收不回去了。现在整个全国上下人心里边又放了冠状病毒这种冠状就叫心霾冠状病毒，大家自私无知无法了，随便打人，随便把人给关起来，随便封上门，这是犯罪呀！所以说，亲爱的兄弟姐妹们，整个咱们这个14亿的同胞被共产党绑架70年以后，现在以最快的速度走向了人间的地狱呀！不但要走向人间的地狱，还要带到全世界下去，要把我们的在国内的所有的家人、同胞、同事们通通带走。我们现在能做什么？传播爆料革命真相，尽可能将国内你看到的、听到的真相发出来。
Heavy stuff. Heavy stuff indeed. You know, you never know, right? You just never know. Like, there's a lot of speculations, you know, but those are real images coming out of there. It's, you know, when they're right along those lines. You know, this is crazy. Person-to-person confirmation in Toronto, or sorry, in the US, and there was confirmation in Toronto also. Yeah. But there's only been one. They said only one case, and that was it. You know, apparently it's only the same one.
CDC is announcing the first instance of person-to-person spread of the new coronavirus in the United States. We understand that this may be concerning, but based on what we know now, our assessment remains that the immediate risk to the American public is low.
Yeah. Like, they have no idea what it is. How can you give a risk assessment on something you know nothing about? You know, the World Health Organization has a global... Let's go see what the World Health Organization actually has to say on this. Where did I put that? Yeah, and this here is the situation report 16. Data updated February 5th. Global level, high. Regional level, high. China, very high. You have the World Health Organization saying it's high everywhere else. But then you have like local media sources saying, no, well, it's low. Like, who do you believe? What? And you see all these crazy, all these things. Like, it's just... Yeah, it's a lot, eh? And it's everywhere now. And it's only growing. Only growing and growing and growing.
Oh. Daddy, signal tower. Signal tower.
Oh, here, sorry. There, now it'll work now. For that. Yeah, oh, what else is there? Let's see, new cases in Taiwan, Singapore,
Milena Basso and her husband of 3 months, Gaetano Cerullo, saved up for this trip for 2.
Yeah, that sounds nice. Yeah, and that's not even the most recent, I don't think. We'll check out this. Yeah, China's Red Cross is under fire.
Days, Dr. Li Wenliang went from treating patients to becoming one. The 34-year-old ophthalmologist diagnosed Saturday with the Wuhan coronavirus. But if action had been taken when he and others started sounding alarms, the severity of the outbreak might have been understood sooner. Struggling to communicate, Li spoke with CNN briefly by phone. You can hear the hospital machine.
Yeah, it's crazy. And yeah, he died now. He actually did. They said that he didn't, and then but he's actually confirmed that. Well, yeah, for a second time that he is. But that's big news, though, from going back and getting 41 new cases on the ship. Health Labor Japan Ministry says 41 new cases. Well, that brings the number to 61 altogether. Out of the 271 that were tested. Yeah, like, this thing's barely making the news. It really is. Just check. Go back. If you don't search for the latest, it's actually hard to find anything. Wuhan rounds up the infected. No, that's... Oh my goodness, I do not like when it does that. Makes me forget. Damn. Whatever. That's so stupid. Makes you want to, like... Yeah. I just don't want to, like, pay it. Because then they just keep charging you ridiculous things or put it up or... Death toll rises 600. Mass quarantines. Oh my god, go on with you. I'm not joining any of your crap. Yeah. But anyways, it's they're going around rounding up the infected, and I can see that because he did put the military in there. You know, there's the military order to go in. Well, not the one, but you know, report from Beijing. Yeah, and basically they're gonna go in there and meet expectations and fulfill the task. That's basically what they're doing. So fulfilling the task, whatever that may be. And you can only imagine, right? It's not the United States military or anything, or you know, people with compassion going in there and doing this. Unfortunately, you know, this military is very, you know, quite brainwashed in a sense. Check out the numbers just for fun. Yeah, we knew those were gonna drop, of course, but they already fell like 7% in the last month, which is huge. It's huge, and it's only gonna keep going down for sure. They injected so much money into the market a couple days ago that they're staying afloat. They liquidated all their assets just to make them look good on the market. But there's no signs of stopping this in China, at least. Look, wow, 131. It just keeps jumping by thousands now. Like that thing is just spiking. So let's take a look over here. What do we got for cases confirmed by region? Those are all the same. UK has 2 now. Philippines, Russia's got 2, same. US has got 12. They got 2 more on, they'll probably get 14 here in the next day or 2. And Canada's got 1 on suspicion as well, so we'll probably get our 6 here pretty soon. Yeah, so it's of course it's going to be in all of these places, you know, closer in the Asian Peninsula, more than anywhere else. Yeah, that's kind of, and we know the numbers aren't right anyway, right? But it just goes to show that they just keep steadily rising regardless. Because there's a lot of people indoors in their homes and they're under lockdown. You know, here it is here. China locks, you know, more Chinese cities are imposing 24-hour curfews and tightening restrictions on citizens, fueling concerns among residents who are already living in fear and, you know, spreading the coronavirus. 53 cities had imposed restrictions on movements as of late February 5th. We will start a lockdown restriction from tomorrow, the notice read. According to the notice, only 1 member of each household is allowed to go out and buy daily necessities once every 2 days. And they set up hotlines and telephone lines if people are going out more than they should, and like they're paying people money to report other people if they're having group activities or if they're close to. It's going to be a disaster, right? But Wuhan's already unfortunately going down pretty quick. Yeah, it's not the greatest for sure, and we don't know what it is. That's the worst of it, right? And we don't know how many, but it's probably quite a few. A lot more than I'm sure is being reported. Yeah, she's quite a Quite an unfolding situation still, but yeah, the cruise ship, 41 people. Wow. So far, like, so that brings it up to 61. You know, I can see that whole place just, that'd be it, right? It would just melt down. Why is it doing that to me? I might get booted here, but yeah, they even let people outside for a bit. Can you imagine? Just like dogs. That's like one of them. That's a very nice cruise ship. Like, super nice. Yeah, they've been on lockdown since the 23rd.
Oh.
Yeah, so this guy is in the city, living alone in a city gone quiet. Wuhan has been under lockdown since January 23rd. Transport is shut down, most shops and businesses are closed, and people are being advised to stay home. Jing is a 29-year-old social worker and a rights activist who lives on her own. For the past week, she has kept a diary which she shares with the BBC. I didn't know what to do when I woke up and I learned about the lockdown. Didn't know what it meant, didn't know how long it would last or what kind of preparedness I should make. There are a lot of infuriating comments on social media that many patients cannot be hospitalized after diagnosis because of lack of places, that the patients with fever are not properly treated. Many more are wearing masks. Friends have told me to stock up on supplies. Rice noodles have almost sold out. A man was buying lots of salt, and someone asked him why he was buying so much. He replied, "What if the lockdown lasted for a whole year?" I went to a pharmacy and it was already limiting the number of shoppers. It had already sold out of masks and alcohol disinfectant. After stocking up on food, so she, you know what I mean? She stocked up. Silent New Year's, a lot to think about. So the 25th. Much interest in celebrating festivals. I want to see what her most recent updates were more than anything. Panic has driven a wedge between people. Many cities and people are required to wear face masks in public. On the face of it, the measures to control the pneumonia outbreak, but actually it could lead to abuse of power. Some citizens without a mask have been thrown off public transport. That was when? January 28th. It's February 6th. In the midst of all this, I can't help but become more on guard. My anxiety about survival has been slowly dissipating. Walking further into the city will be meaningless if I don't make any connections with people here. Social participation is an important need. Everyone has to find a role in society. Yeah, this is coming from a social worker, right? Written in the most probably professional way. But it's real. Global levels are high. It's it's real enough, right? And they're telling us nothing about it. So, what, right? 2 cruise ships quarantined. People are the numbers just keep rocketing. We've just been told that our Wuhan hotel is being requisitioned by the government to hold suspected coronavirus patients. Seems the government is realizing the strategy of self-quarantine at home is a huge problem, leading to more, often cross-generational infections. Yeah. I don't think you're going to stop it as easy. It's, wow. Yeah, they got the rapid test kits now. How quick? Who makes the test? How accurate is it? I'll just read it, I guess. Okay, so where does it say for accuracy? I don't see any accuracy numbers in here. But it just says like it's a mouth swab kind of thing. But it must be, it's just a quick method of kind of testing people at the field level, just to give like, you know, but they'd have to be pretty far along, I think, for that test to pick it up. If there were early symptoms, I don't know if the test would pick it up, because they're having that problem in other places. You know, people showing up and not testing positive for it, and then a couple of days later testing positive, but just barely testing positive, like small amounts in the system. And also, there was a case where it was showing up in the feces before it was showing up in the blood samples. Like the blood samples were clean, but it was like, you know, urine and feces was testing positive for it. So that's kind of scary. Now that's just one case, but you know, I'm sure there probably, and it seems to be a range cases. Yeah, they just keep I don't know, I've been going through so much data here and reading all I can on this, and they're not giving us much information to go on, but you know, like that cruise ship is huge information. Huge. Wow. And there's 2 of them there. 2 cruise ships now. So, yeah, it's always not good news if the numbers are going up, for sure. I think we all can agree on that. But we don't know where it is. We can't see it. And they're saying, well, it's all right. It's all good. Don't worry. But I don't know if I trust that so much. You know, you got people basing off past outbreaks, and this is nothing like past outbreaks, unfortunately. Sure, I will accept your rules. Third case in Italy. I really don't think that's gonna matter. You know,
14 days in, and we were headed out. Checking out after 2 weeks of quarantine. The whole team feeling good. Continuing on. How the 3 of us, CNN photojournalist Natalie Thomas, producer Yong Sheng, and I ended up here is because of where we were 2 weeks earlier. A far more stressful hotel checkout. This was our 3:30 a.m. scramble to the train station. We'd planned for a few days in Wuhan, but 29 hours in, the phone rang, the city was going on lockdown, and we needed to get out. In the moment, we really could not imagine how big this would get. Millions under lockdown restrictions, rapidly rising death tolls, tens of thousands infected, and mainland China essentially isolated from the rest of the world. And we were at the epicenter. CNN decided we should return to Beijing and immediately limit our exposure to others. But we still wanted to tell the story, and we had 350 square feet to do it. So not a bad commute from my bedroom to the living room, or our studios essentially. Can even do it in slippers. This is the backdrop that we've got over here. Snowing today. We, in between live reports, have been doing a lot of research. Yong, our producer, been on the phone a lot, working his sources in Wuhan and Hubei province in particular, in between some of our reports. Natalie, behind the camera there, doing the same. When we weren't on air, we were consumed with getting the story right. Sure, mic check 1, 2, 3. But truthfully, we were still feeling a bit guilty that we walked away from the people of Wuhan. It especially weighed on Yong and Natalie. Yong being Chinese and Natalie having called this country home for nearly a decade. For them, it was personal. So we worked all hours, either video chatting or calling dozens of people still in Wuhan. Yong focusing his efforts on a doctor who tried to sound the alarm early on. Natalie learning from healthcare workers about the dire need for supplies.
The big decision.
Our meals, room service. But just to be safe, for the entire stay, we didn't let hotel staff come into our rooms. And, well, they seemed good with that. As soon as they knocked, we opened, and they bolted down the hall. Even with just a few hours of sleep each night, we were fueled by adrenaline to keep on. To be honest, Natalie and Yong motivated me. Admittedly, we did take one night to relax. It was Chinese New Year Eve, and it was really important to Yong. But then, back to work. Until our time was up. Day 14. All right, everything back to the way it was, and we now head out into snowy Beijing, but masks on this time. Stepping out into the frigid Beijing air, hopping in the car, and continuing our pursuit of this story.
Yeah, so it's all, getting everywhere, but, I guess they were lucky to get out.
A Chinese doctor who sounded the alarm on the Wuhan.
But anyway, that's it for this stream. I'm going to shut her down. Any news updates, I will keep you posted. I'm going to go and grab something to eat and do all that kind of good stuff. Thanks for watching. Share. Take care. Peace.